everyone, it's Jackie and Renee here with Shift Physical Therapy and Wellness, and welcome to the video section of our website. Today's topic of our video is pelvic organ prolapse.
So prolapse is talking about an increase in laxity of tissue in the pelvic area. And so it's really kind of allowing a downward movement of some of the pelvic organs. So some of the organs that might be involved could involve the bladder and the urethra, could involve the uterus or possibly the cervix or the cuff if the uterus has been removed from a hysterectomy, or even the rectum.
So we're going to use some descriptor terms that might sound a little unusual, but remember, we do these videos because we want to be completely open and candid about this discussion. So we're going to be using terms that women come to us and describe what they're feeling. So a lot of times women will feel like a heaviness or pressure, sometimes accompanied by pelvic pain, but not always. And they kind of describe the sensation like their vagina is falling out or they're having their organs fall out.
The great news is that's not really happening. Your organs won't just fall out. So what we are dealing with is, like I mentioned before, that increased laxity of tissue, where sometimes some of those organs are descending downward a bit, but I promise you they won't fall out. And the other great news is that pelvic floor physical therapy can really help some of the symptoms that you might be experiencing with pelvic organ prolapse. So we're not going to be fixing the prolapse, we're not changing that the position of some of those organs, but we're helping to provide support for those organs, and then also teaching you a lot of strategies so that we don't worsen the condition.
Sometimes women might experience what's called like post-void dribbling. So they might start going to the bathroom and all of a sudden they stand up and they leak urine or they dribble some pee. That happens, and that's actually fairly common when it comes to having a pelvic organ prolapse. There's various grades of organ prolapse, and although we do not grade them, we are able to help identify where that prolapse is occurring. Is it occurring more towards the front or towards the back? So again, talking those organs, the bladder, the urethra, the cervix, or is something going on in the rectum? At times, women need to insert a finger into their vagina in order to do a technique called splinting to have a bowel movement.
So some of the things that commonly lead to a prolapse, number one, women who are just very lax throughout most of their joints are more prone to having some type of a prolapse, so I think it's important to note that. Women who suffer with chronic constipation, not just women, actually men as well, but that chronic straining or pushing to have bowel movements can lead to prolapse issues. This can also happen with people who have a chronic cough. So think about people experiencing emphysema or COPD. Some other chronic lung conditions can also lead to prolapse. As well as repetitive heavy lifting. So think about CrossFitters, or maybe it's a laborer who works a job that they're doing a lot of repetitive heavy lifting. And that management of the abdominal pressures, if it's not being managed correctly, can lead to increased strain and pushing. And one of the things that we most commonly see here at Shift is prolonged labor and delivery. So when we're talking about women who are experiencing a prolonged, difficult labor and delivery, that can also lead to this prolapse.
Yep. So what can we do about it? Like, we notice that there's an issue. What do we do? Number one, you need to know whether you have a prolapse or not. Leaking of any kind, whether it's a post-void dribble or stress incontinence, you can check those videos out later. It is not normal. It is common when you have a lot of that intra-abdominal pressure, some of that pressure that we're talking about that can accompany a prolapse. However, it is not normal. So seek help. But when we're talking about pelvic organ prolapse, in physical therapy, what we can do is we can check to see what else is going on at the pelvic floor. Is there some tightness? What weakness is going on? And then help provide you with some exercises and positions of exercises that would be really great for your type of prolapse.
Yeah, so depending upon which organs are involved, it's really important that we get you into certain positions to do some of those strengthening exercises. And that's where it's important to get an expert involved. So seeing a pelvic floor physical therapist to be able to assess what organs are involved in your prolapse so that we can match the correct types of exercises along with it. And also just getting the education that's necessary when you do have a prolapse. Getting education about how to properly breathe during movement, during lifting, also potty posture.
Yes.
We had our video on potty posture that I think is also a very important point for these folks that are dealing with prolapse.
And if it's something that we need to refer on, there's actually, if you see a gynecologist, there's pessaries, which is a tool that can be inserted into the vagina to help support some of that prolapse that might be occurring. So seeking a professional to help determine, like, should I go this route? It's, maybe a non-surgical route that you could take that could be very effective and safe for you.
Yeah, so there's a lot of options when it comes to having a prolapse. I think the other piece that can come from seeing a professional such as a pelvic floor physical therapist is that just getting that confirmation about what is normal. And there's a lot of changes that occur, especially post-delivery. So when we're talking about women who have experienced that long labor and delivery, so oftentimes women can be a little bit scared or nervous about the appearance of their vaginal area. What does the perineum look like? And what are some of those changes that have happened? So just getting some of the affirmation, I guess, that everything is okay. And if something's not okay, again, you've got a professional in your corner who can help refer you on to another specialist if necessary, if something really is beyond the scope of what a pelvic floor physical therapist can help you with.
And oftentimes women don't know that when it comes to pelvic floor physical therapy, it's a little unique than traditional physical therapy, in which we're typically only seeing women maybe only one time a week to one time every other week. So it's not like we're seeing you 3 times a week forever and ever. There's just a lot of support and education that you can get even coming in 1 time a week and being able to help with some of the symptoms that you're experiencing with your prolapse. So we hope you guys learned a lot. Of anything that you guys could take away today is make sure you just start these conversations. Open up the conversation if you're experiencing something that you feel like might not quite be right for your body.